everyone. I am Dr. Gloria. Welcome to Ask Dr. Gloria channel, where health and wellness are made simple and easy to understand. Learn smart and live well. That is our logo. Don't forget to like, subscribe, and share your health and wellness questions you'd like us to discuss. I'm happy to help. Thank you. Let's dive in on what we have today. So, the quiz contains multiple choice questions from different competitive and academic exams. You have 5 seconds to answer each question. Pause the video if needed. I will try as much as possible to pause the video as well. So, what do we have here today? Food safety and hygiene. Test your IQ on how well you know this. So, how well do you know food safety and hygiene? The kitchen rules, the sanitization, the health, because these are related to each other. If you have good safety and good hygiene, you can have a good health in the society. Now, let's dive in. Question 1. Cross-contaminations occur when? B. Question 2. Which of the following is a source of contamination from food handlers? C. Question 3. How often should gloves be changed during food handling? So, you use glove when you're walking. Now, how often should you change the glove when you're handling food? B. As often as hands will need washing. Just because you're using gloves does not mean that your hand is clean or the glove is clean. As often as you wash your hand without using the glove, you should wash your hand as that much when you're using the glove, as much as that. So I put a tip here. Gloves is not equals to, or is not, you can't substitute it for hand washing. Just the way you're washing your hand without a glove, you should wash your hand with gloves. When you put on the gloves, you should wash your hand as much as. Question 4. What is the minimal alcohol concentration required in hand sanitizer for use by food handlers? So, food handlers, what is the amount of alcohol that is needed, the concentration? B. Question 5. Why must wound be covered with waterproof, brightly colored bandage in food establishment? Now, let's create a scenario in a company or in a restaurant. The chef got wounded. So, what kind of band should they use? What kind of the wound cover? What kind of wound cover should they use for the chef? B. That is to prevent pathogen, like why and what kind of, by the way. So, to prevent pathogen from contaminating food. So, you can't allow the food handler hand or wound to get exposure to the food, and to aid detection. So now the question was that why must it be a bright color? In case the cover that they use, the hand bandage they use fell inside the food, it can be easily discovered if it's a colored one. Wound must be covered with blue waterproof plaster. This is the only way it will be detected when it fell inside the food. Question 6. Which of the following is a forbidden behavior in food handling area? B. Chewing gum near open food. Remember about some of the attitudes that are not tolerated by the food handlers. Question 7. What is the correct sequence for effective hand washing? Now, there are effective hand washing. What is the correct sequence? What should you start with? Is it by raising your hand, by scrubbing? B, that is where the hand applies soap, because most of the pathogen needs to be, if you don't use the soap, there is no way you will be able to break in the proteins or the cell membrane depend on the kind of pathogen we are talking about here. And you need to scrub at least for 20 seconds, then you rinse, then you dry. I put a mnemonic here, right here for you. It will help you for your exams or for your daily life. Question 8. Which pathogen is effective in minute dose? If you watch my previous videos, those should be easy for you to answer, by the way. So, which of the pathogen is effective in minute doses, underscoring the critical importance of strict hand hygiene for food handlers? B. Question 9. Why should raw meat always be stored separately from and below fresh produce in the refrigerator? B. Question 10. Which of the following is not a safe recommended practice when reheating food? So, when reheating food, remember this is about food microbiology. So, when reheating food, how often? What is the safe practice that needs to be taken care of? So, which one is not? The question is asking which one is not. If you know which one is a safe practice, you will be able to know which one is not a recommended path. So, we have B. Question 11. What is the specific advantage of using brightly colored metal detectable bandage in food establishments? So, this question is very similar to the one we just did few minutes ago. So, what is the advantage of using a colored bandage or a metal detectable bandage in a food establishment? B. Definitely to make lost bandages easily detectable. Question 12. Which of the following is a key component of a positive food safety culture in a workplace? B. Regular training and supervision. So, if you look at the graph, when there is an employment from the beginning, yes, there will be food safety rules. Everyone follows the rule. But as time goes on, the graph decline. The graph will decline. No more, and everyone is back to their default setting. But when there is a continuous training and supervision, this will increase the high rate of food safety practice and hygiene in the food establishment. Question 13. The primary route of transmission for most foodborne microorganisms is also this question. If you watch my previous video, it will be easy for you to answer. Fecal oral route. Like I said in my previous videos, yes, it's unbelievable, right? But this is the most common route of transmission of pathogenic infections. Question 14. Food should not be kept in the danger zone temperature range. That is, what is the danger zone again? 5 degrees centigrade to 63 degrees centigrade. So the question says, food should not be kept in the danger zone temperature range for more than how many hours? For example, you cook your rice and you bring it out from the fire. So how long should it take before you put it in the refrigerator? 2 hours. Question 15. Which of the following personal protective equipment items is established established for food handler working with ready-to-eat foods. PPE, it should be a familiar time for any healthcare student, definitely, whether you're a medical student, a nutrition student, whether you're a nursing student. PPE, personal protective equipment, should be one of the top terminologies you should know, right? Yeah. B. Question 16. A food handler experiencing diarrhea and vomiting should. B. Question 17. In a proper designed food establishment, separate sinks are designated for hand washing and food preparation. This practice prevents. What is the advantage of this practice? B. Question 18. What is the correct sequence of cleaning and sanitizing food contact surfaces? Remember, sanitization is all about killing all the microbes, right? So, to be able to bring it to a safe place, what is the proper way sequence? C. Question 19. The cold chain in food distribution refer to. Remember, even for collecting specimens, especially the ones that need to be kept in the cold chain, whether you are a medical student, food nutritionist, or any kind of healthcare student, you should know what cold chain means. So, in food distribution, what does this refer to? B. Question 20. In food establishments, controlling allergen cross contact is best achieved by. We have allergy food. So, how do you store this? How do you control this? C. So, if you're able to answer very well to this point, you've done well. Until next time, I remain Dr. Gloria. If you have any question or any topic you want us to talk about, you can drop it at the comment section. Thank you so much.